Loneliness is an aversive state. It's a feeling of emptiness, a feeling of stress, a feeling of depression. It's not the same thing as social isolation. It's better defined as perceived social isolation. Being isolated from others, being rejected from a group or ostracized by a group has profound effects on making us feel lonely. Losing a significant other, again, another contributor to feelings of loneliness. But we have found that loneliness can occur in a crowd. One can be in a city, amongst a lot of people, can be a freshman in a mixer and feel terribly isolated from those around them. So the number of contacts isn't really a very good predictor of who's lonely. It's the quality of the relationship that's the best predictor of perceived isolation or loneliness. One of the early characterizations of loneliness was that it was an aversive state with no redeeming features. As a neuroscientist, we found that a little hard to understand. All negative states, pain, physical pain, although certainly not something that we want to sustain, has very important value for us evolutionarily. You might be asleep, roll into the fire. If it wasn't for physical pain, you wouldn't know that and would damage your body beyond repair. And so it's a call for corrective action. We think that loneliness serves a very similar evolutionary purpose. If you think back in evolutionary times, we would not have survived, and our offspring would not have survived if we tried to live isolated lives. Just as our body needs a signaling system when there's something going wrong with our body, if the group is so important to our species, we need some kind of signal to say that we're starting to slip away from that group. And that's exactly the aversive signal that we think loneliness is serving. When we look at the effects of loneliness on one's psychological well-being, what we find is that people's feelings of loneliness today predicts their negative mood, their depression a year from now. And that's taking into consideration how depressive they feel today. So if you control for how depressed an individual is today, if they're feeling lonely today, they're likely to be even more depressed a year from now than those who are not lonely. In fact, if we look at individuals who feel particularly well connected with others, and you look at their level of depression today, what our research shows is that a year from now, they're going to feel even less depressed than they do today as a result of this feeling of connection with other individuals. Physical health, the story is even more profound. Prior epidemiologic studies had shown that social isolation is associated with broad-based morbidity and mortality, on par with obesity, sedentary lifestyles, high blood pressure. What we have found is that perceived social isolation, this loneliness feeling, is every bit as powerful as objective social isolation. In fact, when we put both factors into equations, looking at the physical effects we've seen, perceived isolation usually is the proximal determinant of these health outcomes. A second issue that we cover in the book that is contrary to what popular opinion had been is what causes loneliness. Many have thought that there were certain individuals who were fairly negative, fairly neurotic, had low social skills, were shy. Those are the ones who were destined to be lonely. Our research hasn't borne that out. When you take a population-based sample instead of just very, very lonely or diseased individuals and not at all, what you find is that loneliness is associated with being a little negative, being a little hostile, having poor social skills, but it's not causal. What we find is that experimental manipulation causes them to feel more threatened, to feel more angry, to feel more hostile, to feel shyer, to have poor social skills. The social skills, for instance, comes from they're not thinking about the perspective of the other. They're the one in danger. They don't have the luxury of taking someone else's perspective. And as a result of taking their own perspective, they act in a more egocentric fashion. And others, that is, they don't pull as liberally from the social skills that in fact they possess. So we have found this feelings of loneliness to be much more a determinant of what personality people show than personality leading a person to live a lonely life necessarily. One of the implications of our research is that people aren't doomed to live lonely lives. Some individuals fall into the grips of loneliness for long periods of time, but that need not be the case. One of the things lonely people feel is threatened, and so they may start to act more negatively toward others and expect others to act negatively toward them. So one of the things that such an individual needs to do is to just get out and interact with people in positive fashions. If you volunteer, for instance, all of a sudden you're doing things nice for others, you're not putting yourself in a position of any danger, you're simply helping others, and it's pretty remarkable to find how nice people are, how much they appreciate the acts of kindness of that form. And so doing so, you find out that people aren't always dangerous. In fact, they can be quite generous in their own behaviors toward you. It just takes us extending to them a little bit. One of the other things that we have found in our research that we cover in the book is that if people are feeling lonely for long periods of time, sometimes we then see reductions in loneliness. All the deleterious, all the harmful effects that we have seen, their increased depressive feelings, their increased vascular resistance, the increased stress hormones, all of those go down with an increasing feelings of quality relationships with other individuals. So although one can accrue such effects from feeling socially isolated from others, it's not a death sentence by any means, that one can actually turn it around and start to live a longer, happier life.